Good morning and welcome to your weekend healthy chat. I'm your host, Dr. Sara, and please join me in welcoming RJ Storm, who is a licensed acupuncturist. Good morning and welcome.
Good morning. How are you, Dr. Sara?
Very good. Very happy to have you on the show. So tell us a little bit about how you got into this line of work.
Well, I did a lot of things in my life, and briefly, I always liked helping people, and at one time, I wanted to be a surgeon.
Okay.
I went to school. I studied a lot of things. I studied some music, and studied some biology, studied chemistry, studied this, studied that, and then I decided, I'd like to go be a surgeon. Somewhere around all that, I also had asthma, and I got put on this medicine. You're probably familiar with it. It's old, Accolade. And I could breathe. Oh, I could breathe. But I had this metallic taste in my mouth. And they wanted me to come back every few months to have my liver enzymes checked. Oh my, I thought your liver, isn't that like a car engine? You only get one of those,
Exactly.
in each life.
Yeah.
So I said, I got to find options. A friend of mine said, oh, you should go up and see Kiko Matsumoto. You should get an acupuncture. She's the one up in, where was she? Newton, Massachusetts. So I went up there. It was
Apparently
best
life-changing.
I felt in 20 years. I was absolutely shocked. So, and I remember looking at these little needles. And I said, my God, these things look cheap. She says, oh, yes, they are. So, well, it seems to me that any trained monkey could stick needles into somebody, but it's where you put the needles. And if somebody really knew what they were doing, you could walk into a village of, say, 1,000 people and really make a difference in their lives for, say, $10. She said, absolutely. At that time, I left medical school and
And you said,
went
"This
to a
is for
different
me."
medical school and I finished and
Great.
I got a chance to work in a little village in China for many, many years. And
Oh, very nice. So how long have you been an acupuncturist?
well, let's see. 6, 7, 8, 9, about 7 years, going on 8.
Very nice. So what are some of the typical patients that come into your practice? Like, what are their presenting problems that you see?
Presenting problems at Dolson Avenue Medical, where the corporation's Mid-Hudson Acupuncture, it's principally is a pain management clinic. Everybody has back pain.
Right.
Oh, my heavens, everybody has back pain. I never saw so much back pain.
Yeah.
Back pain, neck pain, shoulder pain, knee pain. But many times that neck pain or their knee pain, it's a secondary problem to
Right.
something else, or maybe a
Right, an
tertiary
underlying
problem.
condition.
Sure, an underlying condition, and that's where acupuncture can certainly be used as a standalone modality, or it's integrated with everybody else, the chiropractors and MDs and massage therapists and so between that and the physical therapists, we're one big happy family. So the great thing is I not only get a chance to treat pain, but more importantly, the root of a problem,
Right.
which could be asthma. Somebody's huffing and puffing all the time, tightens up their
Right.
diaphragm. Hey, you get mid-back pain. It happens. And fortunately, I see more and more people, well, at least on my end. Maybe I think I'm trying to see more people more receptive to getting help. It's myself included. I think everybody in this studio and everybody out there listening, we all know somebody who are wives, husbands, girlfriends, boyfriends. Say, you really ought to get that taken care of.
Right.
You got to see a doctor for. No, I'm waiting.
Yeah.
It'll get better by tomorrow. And the first thing you know, it's next week. Then
Right.
it's next month, and now you have a problem.
Exactly.
And so, when I see groups of people, I generally, present this very simple thing. You have to ask yourself, am I healthy?
Mm-hmm.
And then the second question is, how do you know when you're not healthy?
Right. And what do you do about it?
Yeah, and what do you do about it? And who do you go to when you're not healthy? And that should begin with yourself.
Right.
Should always begin with yourself. And you recognize who to go to get that help. I mean, if your car breaks,
right.
You need a set of brakes, you need a muffler. I mean, you're not going to go to the Jade Palace buffet, right, to get it fixed. Of course not. Hopefully,
Yeah.
you're going to see, I don't know, George Saucechuck over here is a good guy, or Kenny Ken.
Very true, very true. What are the different age ranges that you see? Do you have any knowing that I'm a pediatrician, do you see any children?
Are you really?
Yeah.
That's wonderful. Reminds me of Dr. Julia Keniston. It was a great, great physician. I went to her. She was. She didn't take any.
Yeah, she's the reason why I do what I do. She was my pediatrician.
Really?
Mm-hmm.
Half of Port Jervis. The age ranges. The age ranges I see, all except infants.
Mm-hmm.
Yeah. We see youth
mm-hmm.
and adolescents and they have their own unique problems. So sometimes people present with acne,
mm-hmm.
for example, and often that's emotionally driven or something
mm-hmm.
like that, or old people. When people get on in years, they start assuming a sedentary lifestyle,
mm-hmm.
or everybody has their
right.
their unique problems. I must say, there's this 92-year-old little lady who comes in. She just doesn't take any guff from anybody. She took her coat off the first time I met her, and she had a Heckler and Koch 9mm slung under her coat, and she's maybe 5'4".
Wow.
And I said, Mrs. So-and-so, how are you today? You don't tolerate much abuse. No, I don't. I don't tolerate abuse from my children, and I just don't like it. I'm old. I don't even buy green bananas anymore. When I want an answer, I want an answer. Yes, ma'am. Now, you're going to give me a straight answer. You're going to help me. Oh, most definitely, ma'am.
Yeah. Yeah, of course. Of course. Do you see a difference between men and women, like what the ailments are that they come in with?
Yeah, usually men don't present with problems like menstrual cramps. I mean,
no, usually not.
I had some very bad ones years ago myself, debilitating. But then I got divorced. I didn't see an acupuncturist. But seriously, a lot of women present. They
mm-hmm.
have very bad cramps every month, and some women, cyclically, they have angular cheilitis.
mm-hmm.
Sores in the corners of their mouth. Don't have to live like that. Don't have to live like that at all. In fact, it's addressed. It's addressed quite effectively with acupuncture. A lot of men, like here at the plow season, there's unique syndromes that come in.
Mm-hmm.
A lot of state workers come in with clutch hip. We've noted. You get a big snowstorm,
mm-hmm.
and you have these old trucks where they have a manual transmission. And now, for the first time in a long time, they're working a 12-hour shift, pressing a clutch, pressing a clutch, pressing a clutch, and then we see them the next day.
Because of the hip pain.
Yeah, hip pain and rotational injuries.
Right,
People are out shoveling snow, and as far as straight pain, a lot of contractors, people,
mm-hmm.
like. What's common? Oh, the sheetrock
mm-hmm.
people who do sheetrock. They run around on stilts, and they're always looking up, and for some reason they have back pain.
And neck pain, I would imagine.
And neck pain. Hit a couple of other home runs recently. My specialty is respiratory acupuncture and digestive disorders.
Oh, okay.
But there was the latest home run we hit was this woman who came in. I treated her sinus problems
mm-hmm.
and her asthma, and I know she was hard of hearing in her left ear, and she had told me that her doctor wrote that off, that she hasn't been able to hear out of her left ear. That's strange. But she had pain over here by the mastoid process and things like that. And in our filter system, we poked around, and I said, well, I don't think it's that bad. So we treated it. And she calls up 11 o'clock that night screaming and crying. And now, if somebody calls you personally at 11 o'clock crying and screaming, you either made a big mistake or you did something good.
Yeah.
Well, her hearing came back.
Wow.
And I guess it's mostly all entirely back after
That's great.
after having that ear written off. Now, I'm not saying that's typical results, but it's a lot of people, like youth, there's something youth present that people want to put tubes in their ears and shunts. And so many times that's doesn't have to be an option. It's treatable.
Well, it's definitely great to hear. Well, let's just hold that thought, and we'll be right back after this. Welcome back. We're here with RJ Storm, and we're discussing a little bit about acupuncture. So now I understand acupuncture can be helpful to folks with respiratory, digestive diseases, things like that. So how is it helpful? All right.
First, let me just say, I preface many treatments. I tell everybody, look, the name is Storm, not Christ. Or Moses, or anything. If you want miracles, you have to go to temple or church or synagogue or something like that. That being said, people present with asthma. Of course, any patient that comes in, we take a good intake because and they're weird questions. We want to know not only where the pain is and how you're breathing, but how's your digestion, your sleeping, how's work, and we want to get a good composite picture of who they are. And then find out, there's two different kinds of asthma. There's some people have problems breathing in. Some people have problems exhaling. Right. Some people have both. So we can reduce the symptomology so people can breathe easier. And now, nobody can see this on the radio, but suffice it to say, if you hold your hands wide apart and you're taking that much medicine, and then you get acupuncture, and then you can narrow that up to a couple inches, and you don't take nebulizers, you don't have to take all those medicines that make people jumpy and things like that. That's an improvement.
Absolutely.
Can't make it go away. We can make it improve. Or like when people go and they take Nexium or things like that, and that's just a part of their basic food group.
Right.
That's crazy. Sometimes that's simple as lifestyle.
Right.
Changes can fix that. You dig a little deeper and you find, their marriage is not so good, or their children are giving them problems.
The stressful.
And,
Right.
Yeah. And so all these things can be addressed and oftentimes improved greatly. Greatly.
How often do you see somebody for, say, digestive issues? Is that someone who's coming to you once a week? Is it more than that, less?
We can see people once a week. Twice a week's a little better.
Okay.
For initially. Initially, we start with twice a week for a few weeks and then taper off. But unless it's some, deep entrenched chronic condition, and then that's have to see where that goes. But typically, that's typically twice a week.
All right, so let's change gears a little bit and talk about the styles of acupuncture.
Styles.
So what are the different styles? Like there's traditional Chinese, classical Chinese.
There is.
Can you describe some of these
Yeah,
styles?
Traditional Chinese medicine is kind of a misnomer, really. Traditional Chinese medicine is what's been packaged since the Cultural Revolution of China. It's become a standard. That is a conventional point of reference with relation to testing and things like that. And it involves an acupuncturist is going to check your pulses. That is, it's not simply, as you might see, checking a pulse, but there's 9 different pulses, on each wrist, each corresponding to different organ systems, and then tongue examination, things like that. And then using a combination of local and distal needles. That is, If a problem is in the elbow, we can put needles far away into the feet or legs to treat that, and perhaps even locally into the elbow. So that's one style. But there's Korean style, French style, Japanese styles, and classical Chinese medicine, how it was practiced, and in some corners still is. And I've been very fortunate to have learned that. My wife is from central China. I got a chance to live there for many years, and I still have a home there.
Great.
And it's one thing when you go to a school and you see these endless pedantic bantering people. Their sole function is to travel the globe and tell you about TCM. This is how acupuncture is practiced, and this endless pedantic bantering, the whatness of the who and the whyness of the if, my God. But when you're in central China, at least where I was, for example, and you get a chance to see, you have an admission ticket, such as your Chinese wife, and you get a chance to meet and study with, say, a 20th generation acupuncturist, as how it was, because there are no MDs in many areas. You are the primary care doctor. And I got a chance to do that for years. But you go there and you find that the classical Chinese style is very, very different. They use a lot of palpation, very similar to Japanese acupuncture, and very meridian-based, things like that. And so there's that style, and it's very gentle. Japanese style is probably the most gentlest. And it should be noted that we use very, very, everybody's worrying about, needles and pain and oh my God. But these needles are at least the ones I use, are like a hair. And I just insert them, and people usually drift off, or they say, did you put them in yet? Yeah, we put them in. And I don't, do a lot of manipulation. I'm not a big, people want to propagate a certain sensation, and I don't do that. In fact, personally, I very rarely put needles locally.
Okay.
I usually put,
distal.
Very, very distal, because there's energetic channels that traverse through the body. So again, acupuncturists don't put needles in a body. We put them in points. I mean, you go to school and you learn, with ears and different subsystems, 400 different points. And where they are and what they do and any contraindications. And then you learn how to make a palette of points or a constellation of points. Sometimes people come in with a very acute problem, a muscle spasm or something, and you're probably familiar with Dr. Travell, trigger point therapy. But thousands of years before, they were called jumping points. And you can introduce, as the provocateur, a needle into that muscle, and a very thin needle at that, and just tickle the myofascia. And once it fasciculates, that's it. The spasm's finished. And it's like, letting a rubber band go. And well, it's not the most comfortable thing. It's not terrible. No one's ever died from it. But people will come in, and after the treatment, they get off the table and they want to sign you over their house or their car. They're very, very happy.
Exactly.
And that's nice. It's lovely being a part of a family that make people feel better.
No, it definitely is. And before we wrap it up, any final tips or any advice on when to start acupuncture?
Well, acupuncture is good for everything except blunt trauma. I don't know how many people went through a windshield and told EMS, get my acupuncturist. But I would say whatever problem you have, you should probably seek the least invasive thing first, which is acupuncture, good for acute and chronic conditions. And also the other aspects of acupuncture include things like cupping, which has become popular with movies, and I leave it to the listener. You can look up, Mr. Google knows all today. You can look up cupping, and we do moxibustion, MOXA, and we do that at the clinic. Sometimes we could do electro-stim. I'm not a big fan of it, but there's a time for it. And I think it's very important, like any good physician out there, the important thing is not what you know, but you need to know what you don't know. So you know when, okay, we have to get help, we have to fall back, regroup, lose this battle to win the war.
Absolutely.
And so one of the most important things when a patient comes in, it's the patient's agenda that's ultimately going to drive the treatment. And we want to, ask somebody, all right, a month, 6 months down the road, what do you want to look back and say, this is fixed?
Right.
And so it's great to be a part, to help that.
That's great. And then if you just want to let our listeners know where you're located.
Dolson Avenue Medical, 54 Dolson Avenue, Middletown, New York. Call today at 845-342-0000.
All right. Well, I just want to say thank you to RJ Storms for being with us today and teaching us all about acupuncture. So thank you so much.
Thank you very, very much.
It was a pleasure having you.
All right.
And now it's time for our email question of the week. And this one comes to us from a worried dad. I hear the flu is out there in full force. How do I keep my 2-year-old and 4-month-old safe? My 2-year-old, as well as my wife and I, received our flu vaccines 2 months ago. Well, influenza is definitely in our community. With the flu, you usually see fever, congestion, cough, sore throat, and body aches. Once the symptoms start, the key is lots of hand washing and using of Lysol to prevent spread. As for the person who unfortunately is stuck with the flu, you have 2 big things, Motrin and fluids. If caught within the first 24 to 48 hours of the illness, ask your primary care physician or your pediatrician about starting Tamiflu. As for your 4-month-old, during flu season, I would try to avoid heavily crowded areas, such as the mall, supermarket, any place like that. And now, if your family and friends want to visit, that's fine, but make sure they're illness-free prior to the visit and lots of hand washing while they're there. Hopefully this helps and you have a very flu-free season this year. For those of you with further questions, please feel free to email me at drsara@middletownchc.org. Again, that's drsara@middletownchc.org. And for those who want to meet with me in person, my office is located at the Port Jervis Center for Primary Care, 140 Hammond Street, Port Jervis, New York, where walk-ins are always welcome. I just want to say thank you again to RJ Storm for being with us today. I hope you have an active and healthy week ahead, and I'll see you again next time. Take care.